Mytopin invatini y cateromaini induced tachycardia in patients with paraganglioma. Definition. Definition invariably ignoring here rate logarithmic medicine for the symptomatic management of stable and hidden paraganglioma. Asymptomatic Chorney Hill failure paraganglioma is rare tumor that binding in certain nerve cells that have deposit to grow in the body. This tumor can affect people of any heat, but most answers showed be with the head of 30 and 50 the tumor in oxide exclude warning. I know cancer benefit of be the invalid nerve part of the body becoming cancerous, malignant, and spreading distally metastasis.
Paraganglioma, as the name implies, is a tumor of paraganglia. Well, paraganglia are cells that are located in various parts of the body. These cells are located in the middle ear, up against the inner ear, and also located in an area called the jugular bulb. And if I were to look back at the back part of this model, I would see that the sigmoid sinus, this is a major vein that drains blood from the brain and empties into a large channel called the jugular bulb. This also has the same sort of cells that we're talking about in the middle ear, the cells called paraganglia. Well, the purpose of these cells is really to detect oxygen and carbon dioxide levels in the bloodstream and get that information back to the brain. Well, for unknown reasons, mutations can occur within these paraganglia cells and causing tumor formation. Most and almost all paraganglia are usually benign. There is a malignant variety of paraganglioma, and it's just referred to as malignant paraganglioma that can metastasize, that can spread from the ear to lymph nodes regionally and throughout the body. So it's important to make the diagnosis. Typically, the diagnosis is made by an astute physician who encounters a patient who has pulsating tinnitus and hearing loss, and a conductive hearing loss. And when they look inside the ear canal under a microscope, they can visualize the tympanic membrane, and they can actually see the paraganglioma behind the eardrum. This is what we call a glomus tympanicum. These paragangliomas also have another name, and that is glomus tumors. So these glomus tumors that arise in the middle ear are called glomus tympanicum tumors. Those that arise in the jugular bulb are called glomus jugulare tumors. These are just a difference in names, if you will, but really the same kind of tumor. A glomus tympanicum tumor, very easily treated with removal and excision. A glomus jugulare tumor is much more problematic, and treatment is really tailored according to the symptoms that the patients have.
Case of a 54-year-old man with an inoperable metastatic paraganglioma in work systemic targeted radiotherapy with ludoxatine was indicated. With heart hypertension, have tachycardia, and the work with control within the house of penosocid, bexamide, metoprolol, metroxyzine, with cardio status and functional status very excellent. After one cycle of the doctor, he had hypertension and tachycardia was new control with the speeding maximum dose of androstenedione and cranioid channel blockers. warranty immediate consideration or additional ready control medication, the administration or invalidate with strike. Under the heart rate on the 3-day from 143 to 92 with per minute.
Now, multiple MR images here demonstrate a large mass in the left upper quadrant. Now, notice that this mass isn't arising from the adrenal gland. It's probably just arising from the retroperitoneum. You can see that it's T1 hypointense, T2 bright, and demonstrates avid enhancement. Now, if it was coming from the adrenal gland, I would say that it was probably a pheochromocytoma, but this isn't coming from the adrenal. This is an extra-adrenal pheo or a paraganglioma.
Pros and cons. Pros. Invalid reduces hilarity. The paraganglioma is often slow grinding and non-cancerous. Medication and under treatment can help control disease and symptoms and even prolong life. And cons invalid might cause is rate broad ventricular extracellular arterial fibrillation. But in can invariably brain in the body becoming cancerous. Paraganglioma produces hormones such as catecholamine and adrenaline that cause hypertension. Use apply in Ecuador, and the Carlos and the Andrade Marine officer in Quito in period of 21 months and 12 6 cases of paraganglioma on the carotid body with treatment evidence a hit incident of carotid body tumor related to his heart family cyst. The ratio for consultant in her case was his pressure on a no painful cervical mass, the underweight surgery for complete incision, the heart no complication.
She said, he needs to go to the emergency room and you need to go right now. I could have a stroke on the table. I think Andy and Janelle thought he might not make it home again. It was just horrible seeing her like that. He was just kicking and screaming and just freaking out. I just felt like I was going to lose her. Next, two medical mysteries that defied the experts. Daisy Hill is living a seemingly ordinary life until it's turned completely upside down by a bizarre lump on her neck that just won't stop growing. David was holding me on his knees, crying, seeing with me to go to the doctor. Then, nothing could have prepared little Tyler Berchielli and his family for the harrowing bouts of stomach pain that would leave him looking almost disfigured. Tyler reminded me of a third world malnourished child with a big distended abdomen. In the elevator, Tyler asked a question. Are they going to cut me open with a knife? And at that point, my heart just stopped. When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In the winter of 1990, 41-year-old Daisy Hill was focused on one thing: staying in shape. I did biathlons. I did races every weekend. I was very athletic. I mean, she's saying, she had some kind of body. And when she hears about a local bodybuilding competition near her hometown, Houston, Texas, her training goes into high gear. Daisy is a go-getter. When she puts her mind to something, she's going to do it. She's just that kind of a woman. Then one morning, as she's checking out her appearance in the mirror, Daisy notices something.
Conclusion. Surgery, the romaine tumor, usually the first treatment opted for paraganglioma is possibly in red unretracted paraganglioma can cause series of life-threatening damage and can progress to triple surgical treatment is not an option. In people with cancer disseminated paraganglioma to remedy heart metastatic medication and under treatment and heal control the symptoms and have it prolong a life. Thank you.